Meningitis. Meningitis is a serious condition that affects the central nervous system. It is an inflammation of the meninges, which is the membrane that surrounds both the brain and the spinal cord. Meningitis can be caused by infectious and non-infectious processes, autoimmune disorders, cancer, paraneoplastic syndromes, drug reactions. The infectious etiologic agents of meningitis include bacteria, viruses, fungi, and less commonly parasites. There are several types of meningitis: viral meningitis and its symptoms. One viral meningitis in infants may cause vomiting, diarrhea, decreased appetite, irritability. Two bacterial meningitis symptoms develop suddenly. They may include altered mental status, nausea, vomiting, sensitivity to light, irritability, fashion open. 3 fungal meningitis and its symptoms. Symptoms of fungal meningitis resemble the other types of this infection. Most common symptoms of meningitis in newborns include 1. Swelling of the fontanelle, which is the soft spot on the child's head, and this may be due to increased fluid. 2. Pressure in the brain, fever, and high temperature, which is a sign that the child has an infection. 3. Rapid breathing. 4. Continuous vomiting. 5. Refusal of food. 6. Constant feeling of drowsiness or difficulty. Most people recover from GBS meningitis. In newborns, the mortality rate is between 3% to 10%. Trusted source for early onset infection and between 1% and 6% for late onset infection. The demo. Babies born before 37 weeks tend to have the highest mortality rate, 20%. Recurrence is also a possibility in older adults. Some 4% trusted source of non-pregnant adults who deal with GBS infections and recover may go on to have another GBS infection within a year. The meningitis vaccine between PATH and the World Health Organization, WHO, with the goal of eliminating meningococcal epidemics. In 2001, the meningitis vaccine project was created as a partnership in Africa. Current control measures rely on reactive immunizations with polysaccharide (PS). Vaccines do not induce herd immunity, are of limited effectiveness in those under 2 years of age and certain immunocompromised individuals. Polysaccharide conjugate vaccines are effective in infants, have consistently shown an important effect on decreasing carriage. The treatment of meningitis. Cephalosporin, major component of the therapy of acute bacterial meningitis irrespective of the age group. To be true, but the first generation is not suitable for treating meningitis. Chief furoxime, to treat meningitis due Streptococcus pneumoniae, Haemophilus influenzae, and Neisseria meningitidis in children. Cefotaxime, ceftazexime, ceftriaxone, and ceftazidime have all proved effective as therapy of meningitis in children and adults when the pathogens are pneumic H. influenza, but they have not been shown to yield an improved mortality or lower morbidity. Only ceftazidime yields adequate CSF concentrations to treat meningitis due to Pseudomonas aeruginosa.